Hello class, I'm Darla Corey. Today I will be discussing tuberculosis and how this disease disproportionately affects prison and jail populations. I am really interested in TB as I am involved in an infectious disease pharmacokinetics lab where we analyze concentrations of drugs in the blood plasma of patients with infectious diseases, specifically tuberculosis. So what is tuberculosis? Tuberculosis is caused by a bacterium called Mycobacterium tuberculosis, which usually attacks the lungs but can also attack the kidney, spine, and brain. TB can exist in two states: latent TB, which has no symptoms, and active TB. Without treatment, 5 to 10% of people with latent TB will develop active TB, which can be fatal if not treated properly. TB is an airborne pathogen and is spread when an infected person coughs, speaks, or sings. Risk of TB is at least an order of magnitude higher in prisons than in the general population, and the within-prison spread of TB is likely to substantially affect the incidence in the general population. The reason for this is because incarcerated populations already contain a high proportion of people at greater risk for TB than the overall population. Risk factors include homelessness, abusing injection drugs, and HIV infection. Along with these, a major social determinant of TB is poverty, and populations in correctional facilities largely come from communities of poverty. The World Health Organization has said that good prison health is essential to good public health, and good public health will make good use of the opportunities presented in prison to control the spread of infectious disease. However, annual median TB rates in prison populations were 29 per 100,000 in local jail inmates, 8 per 100,000 in state prisons, and 25 per 100,000 in federal prisons, compared to 2.8 per 100,000 in the general population. Overcrowding, late case detection, inadequate treatment, and poor implementation of infection control are all hypothesized to be reasons why there is such higher incidence of TB in prison populations. Outbreaks are frequently associated with delays in diagnosis of active TB and crowding in jails and prisons. A big issue facing the prison population relating to TB is the high comorbidity rate between TB and HIV. TB is known as an opportunistic infection, meaning that those with weak immune systems are more likely to contract the disease than healthier people. For this reason, latent TB is more likely to progress to active TB in people with HIV than without. People with HIV are 16 to 27 times more likely to develop TB than people without. It is one of the leading causes of death among people with HIV worldwide. Treatment of the comorbidity is also very difficult and expensive. It puts patients at risk of increased drug interactions and side effects, and needs careful monitoring. Unfortunately, there seems to not be enough resources to adequately treat people with this comorbidity or prevent it from happening. Prison populations also experience issues pertaining to drug resistance of TB bacteria. Drug resistance can occur when drugs used to treat TB are misused or mismanaged. For example, not completing full course of treatment, not prescribing the right treatment, not dosing the treatment correctly, or using poor quality drugs. The number of people who died from TB has actually increased from 2015 to 2016, rising from 470 to 528 due to drug resistance. It is very important for physicians and pharmacists to carefully assess dosages of the drugs that TB patients use and how they are being metabolized by the patient to avoid drug resistance. Treating TB is very expensive and becomes greater when a patient becomes resistant. It increases from $18,000 to treat a drug-susceptible patient to $513,000 to treat most drug-resistant forms of the disease. Patients in prison populations are at higher risk for developing drug-resistant TB due to inadequate health care seen in many correctional facilities. Along with that, drug-resistant TB is contagious, so if one prisoner becomes drug-resistant, they can spread that same drug-resistant strain to many other prisoners around them. Jails and prison health service staff and local community physicians may not be equipped with the proper knowledge and expertise to treat TB, especially in people who have comorbidities. So how can this issue be addressed? Therapeutic drug monitoring remains a standard clinical technique that uses plasma drug concentrations to determine dosages. This is what the lab I work in focuses on doing. It provides shorter and more successful drug regimens, but it is expensive and does not guarantee patient outcomes. However, investing in this and continually monitoring patients for drug resistance and improvements could potentially lead to a significant decrease in TB in prison populations, which leads us closer to eradication of the disease. Along with TDMs, systematic screening and treatment of TB infections and disease among correctional employees and incarcerated individuals is essential to prevention and control of TB. Public health initiatives to battle this issue include releasing treatment plans, policies and procedures in prisons, and TB education to prison staff and inmates. Correctional facilities can fight this issue by actively testing for cases, reporting cases of latent and active TB, and releasing planned treatments and treating latent TB. In conclusion, allocating public health resources to correctional facilities should be a big priority because these are the settings that we can make a big difference in for prevention and control of TB. Controlling TB in correctional facilities is vital to protecting at-risk populations on the outside of correctional facilities when inmates are released. Here are some questions to consider. First, what kind of actions do you suggest we take to combat the issue of disproportionate TB rates among prison populations? And second, how do you think we should combat the increased healthcare costs due to drug-resistant TB? Do you think there will be ethical issues or backlash if spending is increased on prison populations? Thank you!